Whenever I precept nursing students, I tell them to treat their patients like they were friends and family because they are. And I know that one day I'll be on that bed and I want to be treated like a human being, not just a task that needs to be dealt with. Before the pandemic, we barely had time to turn our patients to prevent bed sores, to clean them, to educate them, to provide emotional support for our patients and their families. And then we're asked to do 50% more in the same amount of time. Now, what corners do you think we had to cut? And which intervention do you think is acceptable to skip? Our patient falls increase when there are not enough staff to help patients out of bed. I had one very sick and confused patient with COVID who I saw trying to get out of her bed. She's hard of hearing, so I had to yell through my N95 mask to instruct her to stay in bed. All the while, I'm struggling to put on the rest of my PPE, and I wondered, should I run in to help without the rest of my PPE? Because if she falls, she could get injured. But if I go in without my proper protection, I risk my own health and that of my family. Now, how would you feel about being that family member getting the phone call that your loved one had fallen and injured themselves in the hospital? I was so stressed. I thought I was getting stomach ulcers, so I started taking antacids. I wasn't eating at work because there's just no time. I was worn down and I started becoming numb. And then when my family and I came down with COVID a few months ago, I thought, what am I doing? I'm sacrificing my health and my well-being, and it's not worth it. I updated my resume and interviewed for jobs away from the bedside. But then I realized I couldn't leave. I love my patients, I love helping people, and I am very good at what I do. I decided to stay, to continue the fight, to make the changes needed to help keep my patients safe. And those changes need to happen in our hospitals and in our laws.